So, good afternoon and hello wherever you are in the time zone of the world. And it's my pleasure to introduce Matilda Forsland, who is the Executive Director of Transform Health, a multi-sector coalition. Earlier today, we've heard about health data sharing, interoperability just now, and we've heard about potential data sharings across regions, whether that's some US states, South America, Europe, and Africa. So it seems that common standards, common language, what about a common law? And at that point, I'll hand over to Matilda.
Thank you so much, Bladin. It's a pleasure to join the Sixth Digital Health Society Summit. Thank you for inviting us for this session to present the Health Data Governance Model Law, as you mentioned. So Transform Health is a global coalition of more than 200 organizations advocating for and supporting the enabling environment for the digital transformation of health systems to deliver universal health coverage. Our work centers around three key coalition objectives to accelerate the digital transformation of health. The first one is to build consensus and political will to strengthen the enabling environment for digital transformation. The second objective we have is to strengthen health data governance. And the third objective is to advocate for increased and better coordinated and aligned investment in digital health. And I'm just going to swift the slides here. It's going to be a little bit of a thing here. So across all aspects of our work, we are committed to promoting the perspectives and leadership of youth, women, and marginalized communities. So digitalization and the use of digital tools have become an integral part of health systems and health service delivery. If implemented in an equitable and a sustainable way, the digital transformation of health systems offers a huge opportunity to scale up access to primary healthcare services, strengthen resilient health systems, close equity gaps, and accelerate progress towards universal health coverage. And as we all know, the digitalization has also exponentially increased the generation of health data. Health data is a vital asset and the foundation of 21st century health systems. It enables artificial intelligence, it supports digital transformation, it advances research and innovation, it improves data-driven decision-making, it supports healthcare professionals, it strengthens equitable and resilient health systems, and the list really goes on and on. Ultimately, it enhances healthcare delivery and outcomes towards universal health coverage. However, to achieve this, health data needs to be effectively and equitably governed, including through a robust legislative and regulatory environment, to ensure that the right protections are in place to safeguard data privacy and rights and mitigate risks of data misuse, while also supporting responsible data use and public benefit. This is important to build public trust in health data systems and to fully harness its value as both an individual and a public good. So as discussions advance around the opportunities and regulation of AI, data governance must be central to this. Data governance is pivotal, as we all know, to AI governance, and responsible AI of health is unattainable without robust health data governance. So this was highlighted by the expert panel during the recent strategic roundtable on artificial intelligence at the 77th World Health Assembly, and most recently in the report of the high-level advisory body on artificial intelligence, which recommends the creation of a global AI data framework. So this is why Transform Health and partners are calling for a global health data governance framework to be developed and endorsed by governments as a step towards more robust and equitable national legislation and regulation. So as you can see here on the slide, sorry, I think I've jumped ahead a little bit here. As you can see here on the slide, the case for more robust legislation and regulation to govern the collection and use of health data is clear. There's also growing consensus and wide political and stakeholder support on the issue. During the last two World Health Assemblies, several ministers of health have co-hosted and spoke at sessions on health data governance and expressed strong support for action. So we have worked with governments on these side sessions, including Cameroon, India, Maldives, Philippines, Sri Lanka, and many other countries, as well as the Council of Ministers of Health of Central America. The images that you see here on the screen are just some of the many reports, strategies, and initiatives recognizing the need for action on health data governance, including most recently the adoption of the Global Digital Compact at the Summit of the Future during this year's UN General Assembly, which sets out a commitment for governments on data governance. And then, of course, also the high-level advisory body on artificial intelligence, which I just mentioned. These represent critical opportunities to really galvanize action on this important issue. So among other global, regional, and national initiatives, Transform Health and Partners have been supporting efforts to improve health data governance. So we have stewarded the development of equity and rights-based principles. We have supported the development of a model law on health data governance. We are also working with community-based organizations across East and West Africa, but also across other regions, which we are currently expanding our campaign to raise public and political awareness and galvanize action on health data governance. And this is a campaign called My Data, Our Health, as you can see here on the screen. This is along other efforts to urge government to support the development and endorsement of a global and regional health data governance framework. The principles and the model law provides a starting point and a foundation for a global framework. So we believe that the endorsement of a framework by governments through a World Health Assembly resolution and relevant regional mechanisms such as the Africa Union and others would help build consensus and commitments around a global standard for health data governance and essential areas that should be addressed through national legislation. It would also establish a level of compatibility in national approaches to foster greater legal coherence across jurisdictions, which is important for cross-border data sharing. And importantly, it would also provide a resource and a flexible framework to support governments in strengthening national frameworks. So as I mentioned, the health data governance principles were launched in April 2022 and have been endorsed by more than 170 organizations and also governments. And they aim to align policymakers and other stakeholders around a shared vision of equitable health data governance, where all people and communities can share, use, and benefit from health data. The 8 principles are clustered around objectives of protecting people, promoting health value, prioritizing equity. And they were developed through a multi-stakeholder and inclusive participatory process designed to gather perspectives and expertise and to ensure meaningful engagement of diverse stakeholder groups from across geographies and sectors. And it brought together more than 200 contributors from 130 organizations, including governments, international organizations, civil society, the private sector, youth, and many others. So we encourage governments and other organizations to endorse the health data governance principles and for them to be integrated across policies and programs. So let me now get into the model law. So building on the health data governance principles and how they can be put into practice through national legislation, Transform Health has worked with many partners, including the Africa CDC, the OECD, the AHIN, Pan-Africa Health Informatics Association, the Health Data Collaborative of the WHO, among others, that have been supporting the development of a draft model law on health data governance. And we believe this could form the basis of a global framework. We have worked with a legal team to develop the draft model law with the oversight of an expert advisory group of health data governance and legal experts. And the model law provides a blueprint and a legislative guide and resource to assist countries with their efforts to strengthen national laws and frameworks dealing with health data governance. It is not meant to be prescriptive or imposing, but rather provides a flexible framework that can be adopted to suit legal systems of different countries. So the model law is informed by the equity and rights-based principles that I just presented. It draws on national, regional, and international instruments, strategies, and best practices, including national legislative and regulatory landscape reviews that we've conducted in more than 30 countries. It's also been developed based on review of literature, reports, and other evidence on the topic. It's been developed through a consultative process engaging nearly 1,000 stakeholders and experts from across the globe. And so right now we're in the process of developing an implementation guide that will support governments and other stakeholders to use the model law. We are also working with partners and governments to explore the practical implementation and the testing of the model law at national level. I think I've skipped ahead again. So the draft model law, which you can see here on the QR code on the screen, contains core elements, guidance, and reference legal text to support more effective and equitable health data governance. It's a starting point to build a consensus across countries and stakeholders around essential areas that should be addressed through national legislation. And it helps to build and establish a level of harmonization in national approaches to foster greater legal coherence across jurisdiction. The model law aims to serve as a resource for governments by offering legislative guidance and reference text to assist countries with their efforts to strengthen their national laws and frameworks dealing with health data governance. The model law provides a balanced legal framework aiming to strike a delicate balance between the protection of personal and community health data. It also facilitates the use of health data as a force for good. It ensures the health data use is anchored in principles around equity, justice, and respect for human rights. It addresses challenges and opportunities presented by emerging technologies, ensuring that innovation in health data use does not come at the expense of fundamental human rights. It seeks to foster a harmonized approach to health data governance, while also respecting the diverse legal, cultural, and societal landscapes of different nations. It assumes the existence of national data protection laws or regulatory framework, and it builds on those. So where countries do not have a national data protection framework, it recommends that this is prioritized. And given that the model law provides a template for national legislation, it does not establish a framework for cross-border data sharing, though it does recognize the supportive provisions needed within national legislation. And so to operationalize a cross-border data sharing framework, we need a framework or agreement to be negotiated between countries separately. So the intended use of the model law is for the model law to offer guidance to countries. It is not meant to be prescriptive or imposing, but rather offer a blueprint and a legislative guidance and resource to assist countries with their efforts to strengthen their national laws and regulation. It provides a flexible framework that can be adopted to suit the legal system of different countries. And it does not need to be implemented as a single health data governance law, but can be implemented using different legal text within the model law to suit the existing national law. It is not intended to create a framework for health data governance. It also requires the publication of regulation to provide further details to the law. So here you can see on the slide, you can see the main sections and provisions of the model law. So these include the health data court, individual rights, portability of electronic medical records, prohibition on re-identification, communities' rights and their community health data, rights and obligation of health data generators, using health data in the public interest, pandemic and other public health emergencies, emerging technologies, feedback confidentiality and protection of whistleblowers, offences and penalties, and subsidiary legislation. And I won't go into this, but this is just to give an overview of what the model law entails. And this is my final slide. Government leadership is critical to move towards a global and regional framework for the governance of health data. and more robust legislation and regulation while ensuring diverse stakeholders, including civil society, remain meaningfully engaged. So we encourage governments and other stakeholders to prioritize this at upcoming moments in order to advance discussions and turn recent commitments into action. We encourage governments and other stakeholders to request health data governance on the agenda of the upcoming WHO Executive Board meeting in January, looking towards the World Health Assembly in May of 2022. We also encourage governments and others to champion the development of a global and regional framework containing provisions from this model law that I've presented, including sponsoring a World Health Assembly resolution. And we also encourage stakeholders, governments, and others to endorse the health data governance principles as the foundation for stronger legislation, regulation, and a global framework. And also to consider how provisions from the model law can be adopted into national legislation to ensure health-specific data is protected. Thank you, Bledin, and back over to you.
Matilda, thank you. Very impressive the amount of work that you have undertaken at Transform for Health. And um, just for everyone who is listening in, the Digital Health Society has endorsed the data governance principles. So I encourage anybody who is out there that has an interest in health data governance to go and take a look at the principles and the modern law. And if you feel able to endorse it, please do. Some questions, I think, Matilda, just to start us off. Which countries are likely to be early adopters, do you think, and users of the model law?
Yeah, thank you. Great question. So we are actually working very closely with the Africa CDC on this in the lead up to the Africa Union Summit this year in February. And we have a number of countries that we're working very closely with in the Africa region at the moment that have shown a lot of interest in validating the model law and then advocating for a regional framework across Africa. So some of the countries that we're working with at the moment include Uganda, Rwanda, Malawi, Senegal, Zambia, and South Africa. Those are some of the kind of early adopting countries where we're also testing the model law, as I mentioned.
Thank you. And for anyone who's out there, whether they're individuals or from different types of organizations, indeed companies, if they want to get involved with you, what's the best way of doing that?
I mean, it's reaching out to us. We have a lot of different advisory bodies and groups that we bring together to draft the model law, for example, but then also do testing of the model law. So we have an advisory group on the model law that we bring together, to shape the work. So yeah, getting in touch with us and then we can explore ways that they can get involved and engage with us.
One of the questions that's being asked in the chat relates to resources and whether you have resources to assist any of the organizations in LMIC countries, if you like.
Yeah, I mean, so we have some funding that we receive funding from different philanthropic organizations that we work closely with. And so in order to test the model law at the moment, we are using some of that funding and we are working with partners with smaller funding, I would say, but we're always looking for more as well. So yeah, we'd love to have conversations with stakeholder groups that would like to also collaborate with us and to kind of make the pie bigger. That's always something that we're working towards.
Great. And perhaps a more difficult question around the legal part of it. And I know that you have a colleague with you to help you out with some of the technicalities. There was a chief scientist in the US who used to refer to standards as standards are like toothbrushes. Everybody has one, but nobody wants to use yours. And I sometimes wonder whether laws are a bit like that, that there's a rush for some countries, for example, to legislate on AI, when in many ways you look at digital and you think digital is truly global. And if it's fragmented by individual regulatory systems, that doesn't help achieve the rollout, if you like, and the maximum use of some of these technologies, in particular digital health. So I'm just wondering how you see the relationship between some of the more technologically developed countries who have already legislated or are in the process of legislating in relation to AI, and how this model law will work, just so that we can perhaps enlighten some of the listeners to actually how you think that relationship will work.
Yeah,
Thank you
and
so
I'll
much.
invite Marietje both. So she's one of the legal experts that have worked with us on the model law. Over to you, Marietje.
Thanks, Matilda. Yes, that's a very important question. And that is exactly the premise on which this model law was created for. It's not prescriptive, so it's supposed to fit each country's political, social, economic, developmental infrastructure as it finds it. The only requirement for the health data model law is that you have to have data protection legislation in place. The reason for that is that the majority of countries these days do have data protection legislation in place, and we didn't want to duplicate that. So that's the reason. But other than that, it was built in such a way that you can almost in a modular fashion include it in your existing regulatory framework. So the model law can actually meet you where you are at that moment and guide you through the process. And ultimately, if you adopt all the sections of the model law or the model law in its entirety, it will get you up to speed to make you compatible with other countries, for the reason being that health data needs to be shared cross-border to have huge impacts. So this is a small part that a health data governance model law plays in the bigger digital framework globally.
That's very clear. Thank you. And I think, how quickly do you think you might start to see these model laws being adopted? What's the sort of time frame, if you like, or do you have any idea from when you produce the guidelines that Matilda mentioned to actually seeing the laws being passed, just to give people some sense of timing?
Well, if I may, the model law itself moved very fast, thanks to all the efforts and opportunities by Transform Health, which is commendable. With the implementation, from my personal perspective, I'm also involved in the team that's trying to do the implementation testing in South Africa specifically. We have a very robust regulatory framework, and we would like to investigate a regulatory sandbox model to see whether we can test this with the information regulator in South Africa. That would ideally take about between 12 to 24 months, ideally in theory. But with theory comes challenges, and everybody needs to work together and resources, etc., etc. So it could happen theoretically very quickly, but because the implementation is a reiterative process and we do want to go back to see what the challenges are and to correct them to make sure that we can make recommendations for good implementation, it could take longer. I'm not sure.
Well, I still think that's very quick in comparison, let's say, to European legislation and how that's developed. And I guess that's why Matilda's encouragement for government support at various international group levels is really important to actually drive through the adoption.
Yeah,
So I think
yeah.
so.
I
I
think
think
maybe just also to add to that, I mean, in Kenya, I think we saw the development of the Digital Health Act, which happened actually quite quickly when there was political will to move that forward. The Digital Health Act was adopted quite quickly. It was, I think, it took, from drafting to adoption, it took about a year, which is remarkable. But it has run into some kind of enactment issues at the last stage, which I think they have now overcome and they're moving forward. But it is pretty amazing to see how quickly it can happen if there is political will and if there is, a drive within the government to really adopt these legislations.
Great stuff. And I think that if you have any final words, or I'm happy to sort of have a quick closing remark. Okay.
Yeah, yeah. Well, I think I will just leave it at what I mentioned before. We would really want to encourage everyone that is here listening in today to work with us to advocate for governments to really position this at the World Health Assembly in 2025. I think we all agree that we need a health-specific data governance framework, and the kind of the right opportunity for that and for that agreement to happen is at the World Health Assembly. So the more that we can come together to work on this collaboratively and to push for this from our different viewpoints, I think the more successful we are going to be. And we would also encourage everyone to endorse the health data governance principles as a foundation for stronger regulation and legislation and a global framework. And for the model law to be a foundation for how we can move forward collectively towards a global framework on health data governance. So I'll leave it there. Thank you so much for the invitation to speak. It's been really fantastic to follow your summit today, and look forward to further collaboration.
Fantastic. And you know that we do quite a lot of work in Africa in particular, and we're founder members of the African Digital Health Network. And so if we can use our contacts to help you, we will. And a quick shout out for you, because I know this is your Digital Health Week, and that our event is part of your Digital Health Week. So if other people are looking for things to do, visit your website, see the other events. But so thank you very much, and we are allowing to close a little ahead of time. So thank you both, and good luck with everything to do with both the framework and the model law. Thank you.
Thank you
Thank
so
you, Bladen.
much. Have a great day.